On Capitol Hill, Representative Greg Murphy is leading a bipartisan effort to help keep health care affordable for seniors. The legislation entitled Preserving Seniors' Access to Physician Act is designed to reverse a decrease in the amount that Medicare reimburses members for seeing a physician. Representative Murphy joins us now. Thank you so much for joining us tonight. And listen, you're a medical doctor, so all of this is very common sense to you. But for our folks that are watching, give us a little bit of background. Folks for medical doctors, the reimbursement.
Yeah, I'll paraphrase. In 1965, the Medicare program came out, and this was providing health care access for individuals over age 65 with a couple other categories. And to put things in perspective, Laura, at that point in time in 1965, there was life expectancy was about 70. And so they set the age then at 65. Life expectancy now is into the early 80s, if not late 70s, and some 2 to 3% into their 90s. And so what happens with these physician fee schedules is that CMS, Centers for Medicare Services, comes out with a certain rate every year, something called relative value units. And based upon that, they say this is what they're paying for each of those in the following year. So what's going on right now is they're instituting yet another cut, 3.4% to the relative value system. So it's cutting physician reimbursement 3.4%. Putting that entirely, physician reimbursement over the last 20 years has been cut 26%. So there's no other field where you can expect to be cut every year. So this is where it's becoming an access issue for Medicare patients.
And we should note that while this cut is coming, they're also anticipating an increase in the cost for this over the next year.
Oh, absolutely. Because if you look at the mechanics, the difference between age in 1965, between growing from 65 to 70, what the cost of that was. Now, if you look, and we've had an absolute explosion. Good Lord, just look at the television on how many drug ads you have explaining this condition, that condition. So there's so much cost to living longer, which is a wonderful thing, but it adds cost to the Medicare system. And, we're doing it in a trajectory. I said it was 4.6 persons paying into the system for each recipient in 1965. We add 10,000 people a day to the Medicare rolls. And so there are fewer people paying into it. So that 4.6 number is down to 2.9 and dropping. So we're losing money. This is one of the greatest sources of our debt in the debt issue for the country.
So let's put this in terms for folks of why they should be concerned about this, because this might stop some physicians from taking on more Medicare patients.
Absolutely. This is an access to care issue. And, just looking at some of the data, Kansas is the #1 state in the country with decreased access for primary care physicians. North Carolina is number 18. Remember, we've had such an influx of individuals wanting to come retire in North Carolina. I think it's important for folks to know that when you take a Medicare patient, when you receive reimbursement for that patient for seeing them, that money given to you does not pay for the cost of care. It doesn't pay for the pro rata share of paying your light bill, the nurses, the staff, the electronic medical records. So every time a physician sees a Medicare patient, they actually lose money. That money has to be offset then with money taken in by insurance companies for younger patients. But if you move in the state in 65, truth be told, good luck in finding someone who's going to take another Medicare patient. It's a real problem.
I was glad you brought up that point about covering the costs of the rest of the staff on there, because listen, a lot of folks are going to say doctors make a lot of money. They'll be okay if you cut a little bit for them.
Yeah, that's quite an interesting comment. Yeah, physicians do well, but I'll argument on the other side. We're the people who've been driven most to succeed the most in school. Our schooling, I was 32 years old going straight through school before I ever earned a living wage. You don't get paid much in residency. And so the mounting debt that you have from 4 years of college, 4 years of medical school, and then residency, I did 5 years, where you can't really make enough to pay the bills. You have massive debt, more than, people estimate it's more than a mortgage now, just literally coming out. But, we also want our brightest individuals, those who are the most driven, to take care of people. You know, how many people are going to get up at 2 o'clock in the morning, take care of your grandmother who can't breathe? So I have no problem with physicians being one of the higher paid careers in the world.
So talk to me, where is this with Congress? And is this something, I know that this is a bipartisan effort. Do you see there's been some action on this?
Yeah, I submitted H.R. 6683, the Preserving Seniors Access to Care Act. Sadly enough, it got stalled in the Senate, and I'll just say very plainly, it got stalled by Senate Democrats because they wanted a huge wish list of other real progressive items in exchange for helping physicians. But the Senate Democrats have said no. And, it really hurts my heart because this should not be a political issue. If you have a 65-year-old person that can't get access to care, what do they care about politics? So this is a hard part. We had a fix. We had a pay for coming from the Medicare Improvement Fund, which is what it's there for, to just keep people whole. We weren't even asking for a raise. It was just to keep people whole. And so I think it's very important. I'm going to pick my own specialty, urology, which is surgery of the kidneys, prostate, bladder, those kind of things. We're dealing with a growing aging population. We're 30% down now as it is. And the median age for urologists in this country, meaning half above, half below, is 55. So we're going to have so many people that just literally throw up their hands with so much burnout, red tape, fighting insurance companies that they just say, the heck with it, I'm done. So we're in a real problem right now.
Representative Murphy, thank you as always for joining us and giving us a little bit of background on this issue.
Great. Thank you, Loretta. Have a good evening.